Technology is really going to help in a lot of areas of specialty pharmacy, but I do think in patient monitoring and care coordination, we can really tap into technology as it evolves to help us take care of patients. These medications are really complex, and it is, really hard to get patients initiated on therapy, and it's really hard to coordinate them staying on therapy, especially when it takes multiple entities and multiple providers to take care of those patients, and there's very little transparency. So I think that is where technology will really come in and help us. We need to automate things as much as possible and create safeguards so that these patients don't fall through the cracks when it comes to their patient monitoring and their care coordination, and they don't experience gaps in care or not being able to stay on therapy because a step that needed to be performed wasn't performed. Yes, absolutely. So I think specialty medications themselves and how complex they are definitely lends to needing additional help and support taking care of these patients, and that's where technology can really come in and help us shine. I feel like the access to these medications can be really difficult, and that's where technology really can help us make sure that we're optimizing access for patients who really need these medications. And then additionally, just how complex these medications are to monitor and the monitoring requirements that are needed for some of these medications, and all the different teams that have to be involved in making sure that the patients are able to stay on medication. This is really where we can use technologies to help us, identify patients who might potentially have problems and intervene for those patients so that they, are able to stay on therapy safely.